So, hello again. My name is Lauren Okano. I'm with Fluence. And for those of you who are new to Fluence, we provide psychedelic training and education to clinicians, industry developers, and clinical trial researchers. And you are joining us for our monthly webinar where we explore the complexities and opportunities shaping the future of psychedelic therapy. And today I have major jazz hands and a whole lot of gratitude to be in the presence of the brilliant, heart centered leaders in this Ibogaine space, and that's Dr. Bruno Rasmussen and Brian Hubbard. Without further ado, I'd love for Bruno and Brian, would you like to introduce yourself um, and what brings you to this work? Maybe we'll start with Brian. Oh, we lost Brian. Well, we'll start with Bruno.
Okay. Okay, so I'm Bruno. I'm a medical doctor. I live in Brazil, and I work with Ibogaine since 1994. It's a long time. And my here in Brazil, Ibogaine is legal, so it's not so difficult to work with it, like in other countries where it's banned. But we have some challenges here too. The biggest problem that we have is that the treatment is very expensive, so we are fighting to try to make it accessible to more people. And I'm very grateful to this opportunity to participate in this webinar and to share my experience with you. Thank you very much.
Beautiful. Thank you, Bruno. I think we'll just keep moving, and if Brian comes back, then we can pause and he can do an intro. Um, but I do want to name for our participants that Bruno and Brian are representing the clinical and policy perspectives. And these are not the only perspectives. And so while we won't be speaking directly to the pivotal wisdom in the indigenous spiritual and ceremonial perspectives, it is a gift to speak with Bruno and Brian. And I know and feel that they hold a lot of appreciation without appropriating those perspectives. So wanted to name that. And as we get started, I wanted to kick us off with a quote from Dr. Gabor Mate's In the Realm of Hungry Ghosts that I think is really grounding for this conversation. He writes, "The war on drugs is cultural schizophrenia. It expresses a split mindset in two ways. We want to eradicate or limit addiction, yet our social policies are best suited to promote it. Once we understand that the current assault on people with addictions creates greater insecurity for everyone and severe hardship for users, and once we understand that stressing people chronically and mercilessly can in no way promote their capacity for healthy transformation, it becomes a straightforward matter to envision approaches that rely not on moralizing, but on science and humane values." So, Bruno, let's get personal. What is Ibogaine? And tell us a story of who stands to benefit most from its potential for healthy transformation.
Okay, so ibogaine is a compound that is found in some plants in Africa. The two most common plants from where we can extract ibogaine is the Tabernante iboga plant and the Vuacanga africana plant. And in Africa, they use this for from millennia. Since the prehistoric times, there are drones in some places that we can identify that they were using iboga, the plant, the Tabernante iboga plant, and they have like a religion that is called Bwiti, and this religion, for this religion, the Tabernante iboga plant is sacred. So normally, at the age of 17 years old, people used to take iboga in a beautiful ceremony, and after that they are considered adults because the people there believe that iboga or ibogaine transform teenagers in adults. So after this ceremony that normally takes 3 days, they start to do the works that adults are meant to do in their culture. And in the 60s, in 1962, there were an American guy who was called Howard Lotsof. He was addicted to heroin, and he decided to experiment ibogaine to see what was that? Because he heard that Ibogaine was a very powerful psychoactive drug. So he decided to experiment it. And he had this experience that we will explain better. It's a psychedelic experience where we see images of our childhood, of our teenage years, and this experience puts the patient, in a introspective state where he can think about their lives. They can think about what they have done, that was good for them, that was not so good for them, and they have the opportunity to understand better their lives and to change some things that sometimes need to be changed. And in this context, it's the drug use. The most of the times, the patient understands that using drugs is not being good for them. They are not having benefits of it from it, so they decide to quit. But interestingly, it's not a decision, only a decision, but you, because of the biochemical effects of ibogaine in the brain, you will stop feeling withdrawals, you will stop feeling cravings. So it's easier, a lot easier to stop when you are feeling good, because when you are addicted to something and you decide to stop, but sometimes you feel so bad that it's difficult to stop. And with ibogaine, you don't suffer so much. Sometimes you don't suffer anything, so it's easier. Howard was very impressed with this because this happened with him. After 24 hours of taking ibogaine, he was not feeling cravings, he was not feeling withdrawal. So after that moment, he started to be an activist of the ibogaine cause, trying to find a place where it could be researched and in a way that it could be developed as a medicine. But this was in 1962, as I mentioned it. But until now, we didn't finish his work because there are a lot of special situations that are not allowing the project to go very smoothly forward. So at this moment, there's a lot of people, where Brian and me are included, trying to some way make ibogaine more accessible to everybody that needs
Beautiful.
it.
Thank you for that intro, Bruno. And Brian, I'm going to head back to you since you've rejoined. I'd love if you could introduce yourself and then also share a bit about um, in your sphere of influence, who stands to heal and benefit the most from ibogaine.
Thank you very much for asking me to participate this morning. All right. My name is Brian Hubbard. I am the newly named CEO of Americans for Ibogaine, a 501c3 chaired by former Texas Governor Rick Perry that has as its central mission the creation of a multi-state framework following the successful passage of the Texas Ibogaine Initiative that will allow us to hopefully make the medicalization of Ibogaine within the United States the Manhattan Project of our time. Before coming into this role, I had served in the Reed Foundation as executive director of the American Ibogaine Initiative, which had as its goal the creation of a public-private partnership model that would see FDA drug development trials within the United States for Ibogaine as a breakthrough therapeutic, first for substance dependency, and then for any other mental health or neurological conditions for which it demonstrates efficacy. And before that, I had spent several years in Kentucky State Service. The last official job is that of the head of the state's opioid commission, where this concept of a public-private partnership for Ibogaine was conceived. At present, as I said, our goal is to do everything that we can to expedite the medicalization of Ibogaine within the United States. And you asked the question, who are individuals who can benefit? And I think that we can just take a brief look statistically at where the United States is. And when it comes to individuals who are dying prematurely from deaths of despair, deaths that are related to alcohol-related disease, drug overdose, and suicide. It's my opinion, just from listening to individuals, mostly military service members, special operators, and others, who have gone down to Mexico as a last Hail Mary pass to save their own lives, that Ibogaine has breakthrough therapeutic potential to treat both trauma and addiction, two conditions that often walk hand in hand and that come through the door together. We recognize that what we have right now in the United States are systems that deploy pharmacology that are not making the sort of impact that we need them to make over the long term. If we are to change the trajectory of what is now the 29th year of the American opioid epidemic, paired with alarming increases in rates of suicide and alcohol related death, I believe that Ibogaine has the ability to address the entire person, and that is mind, body, and while perhaps not conventionally referred to in scientific circles, the soul. You have to be able to address all three of those. And it's my belief that Ibogaine represents a very unique opportunity to create a therapeutic that operates in all dimensions of the human being in a way that makes it a true breakthrough opportunity.
Beautiful. Thank you, Brian. So let's explore a future in which Ibogaine is available as an opportunity to heal the mind, body, and soul. And so I'd love to learn a little bit more about your current perspective on the current state and gaps. And so, Bruno, in the clinical practice and Brazilian context, and then Brian within the policy and Texas context. So, what does the current landscape look like and what's on the horizon?
Okay, so the biggest problem and the biggest concern about ibogaine is that ibogaine has some cardiac toxicity, and in some special and very specific situations, it can lead to a cardiac arrhythmia. And this cardiac arrhythmia can be life-threatening if don't treated the way it should be. But we know, after all this time, that ibogaine is being used most of the time underground to treat addictions, that we know how to deal, to prevent these arrhythmias and to deal and to treat them. So the most important thing is that you do the ibogaine treatment in an environment that you have resources to deal with these things, a hospital or a very well equipped clinic to with access to CTI if needed. So that's what happens in Brazil. In Brazil, it's mandatory that you do the ibogaine treatment in a hospital. Some people don't do that, but it's the right way to do. Because if you are in a hospital, you have, as I said, the resources to deal with any problems. But most important that treating the arrhythmias after ibogaine is preventing them. So, and you know how to prevent them. You can do some medical blood tests before the treatment, which will identify some problems that you can solve. You must do an EKG to identify some problems that most of the times can be solved. So it's important that ibogaine is seen with respect. It's a strong medicine and not seen as we can see that sometimes people see ibogaine like a drive-through treatment. So I arrive today, I take ibogaine tomorrow, I'll be back at my house the next day. No, it's not that. You must prepare yourself physically and psychologically. It's a strong experience, it's a very deep experience. If you are not prepared for it, you can have some consequences of this because it's really strong, and you cannot control the experience. So if when ibogaine starts, you have just to wait to see what will happen. You cannot uh, control the experience to happen what you want to happen and not to happen what you don't want. So it's very important that you prepare yourself, as I said, physically and emotionally and psychologically. Stay at the place where you take an ibogaine for 24 to 48 hours to stay in observation to the doctors, the nurse, stay around and see what's happening. And after this, stay sometimes, let's say, like resting. You don't it's not mandatory that you stay at the hospital more than 48 hours, but you should be around with some people that understand the care team, be around to help you if you need. That's why we are very straight into this here in Brazil. So that's why we never saw big complications here in Brazil. We never saw people dying here in Brazil. I've treated more than 2,500 treatments. I never saw a death from Ibogaine. I never saw any major complications. Sometimes we see people vomiting, but this is normal under Ibogaine, but not complications. But the fact is that we are very strict about this. Some patients, when they arrive, we simply don't do the treatment because we see that they are not in good clinical conditions or even in good psychological conditions. So Ibogaine is not as the other psychedelics are. The other psychedelics are strong too, are available too, but they are not so hard in the body like Ibogaine is. So Ibogaine must be seen with caution, and it's not a thing that you could take at home, at your friend's garage, in a little farm by the river. It's a thing that you should take in an environment where you can be protected by people that understand what's happening. Doing this, it's safe, it's okay, and it's very effective, not only for addiction, mainly for addiction, but for depression and for, as Brian mentioned it, other diseases that now we are understanding that Ibogaine could be helpful, like Parkinson's disease, like multiple sclerosis and other problems that in the future maybe we could understand that Ibogaine helps. Anyway, it's a different psychedelic, a very strong psychedelic that should be handled with care and with respect. Doing this, everything went fine, and a lot of people has had benefits from Ibogaine and will in the future benefit from Ibogaine too.
Amazing. Thank you, Bruno. It's very obvious the care and intent that you bring to ensuring patient safety. Brian, in your context, what does a future in which Ibogaine is available to the people and communities that you named look like? And what's on the horizon within Texas?
A future in which Ibogaine is available is a future in which we hopefully, on the other side of pharmaceutical development, are able to develop a treatment model which recognizes that an Ibogaine treatment is not an end, but is a beginning, and that treatment be maximized not just from the medical perspective of being able to make sure it is administered safely and efficaciously, but hopefully administered in a way that incorporates the centuries of wisdom that originate in West Africa as to how you create the maximum therapeutic impact of an Ibogaine experience within an individual who has received it. We want to make sure, as we are shepherds of this opportunity, that we try to achieve multiple objectives at once. It is about the FDA's approval of Ibogaine as a breakthrough therapeutic for substance use disorder, as well as any other mental health or neurological conditions for which it demonstrates efficacy. It's about the appropriate incorporation of that medication into a U.S. medical infrastructure that is currently beset by issues related to access and affordability. We don't want to take Ibogaine's unique restorative powers and just drop it into a dysfunctional system. It is a singular and unique medication that has singular and unique potentials, and it needs to be deployed within an infrastructure which helps solve access and affordability issues that plague U.S. healthcare. Now, I'm speaking in terms of strategic objectives, and solving these problems will be a process. But ultimately, Ibogaine should be available for anyone who has a need to receive its therapeutic benefits. When we look at the existing U.S. substance use and mental health treatment infrastructure, we see a tremendous amount of resource burn. When I was working in public service in Kentucky, I was able to quantify through an examination of the state's Medicaid database. And for people in your audience, Medicaid is the single largest third party public payer of healthcare services in the United States, covering generally about 1/3 of the U.S. population, with a defined benefit limit of about 200% of poverty for families of four. So this covers very much a poor and working class sector of U.S. society that is disproportionately impacted by substance use issues. Right now, to take an individual, for instance, who has opioid addiction and to plug them into a recovery process, the very first thing that happens is they go into a 30-day treatment center paid by Medicaid for 30 days. This initial 30 days of treatment in 2022 Medicaid dollars costs $36,000. And at the end of that 30 days, the hope is that you have stabilized an individual to the point to where they can comply with a treatment plan for the administration of medically assisted treatment. That treatment involves the induction of either methadone, which is an opioid, or Suboxone, which is also an opioid, for the treatment of opioid dependency. When a person exits 30-day inpatient treatment, they are then plugged into a 90-day intensive outpatient treatment protocol. And this involves going into the Suboxone or methadone clinic 3 times a week for urinalysis, for blood testing, both of which are aimed at making sure that the individual is not taking any illicit substances while they are also receiving their prescribed medication. They receive counseling, and they do this for 3 months. And that costs an additional $72,000. So right now, our current model, just for treatment of substance dependency, takes 120 days and costs $108,000 and yields an efficacy rate, and by efficacy I mean successful compliance with the medical treatment and treatment plan given, of about 25%. So we're spending an immense amount of money. 3 out of 4 times that money does not yield a successful result. And the average number of times a person will go through this system is 5. We're spending at least $500,000 per substance dependent person on what is a 75% failure rate. Now, within that immense deployment of financial and human resources, it would seem as though we've got an outstanding opportunity to build an Ibogaine-based treatment model that is fully operational, fully competitive from the therapeutic effect, and fully competitive from a financial perspective, where we should ideally be able to recapture a substantial amount of actuarial savings that can go into assuring that we have universal therapeutic access that maximizes all of Ibogaine's benefits over what should be the deployment of a long-term treatment and recovery infrastructure, which keeps its hands on an individual consistently to assure that they're able to rebuild their lives.
I'm sold. That is so incredibly compelling. And Bruno, I want to actually ask you, because you are in the Brazilian context with a very different model of healthcare and health system. So I'm wondering, what would it look like in the Brazilian context, and what does the US have to learn from you all?
Okay, I just want to comment about what Brian said, that the size of the failure of the traditional treatment is more than 70%, and the efficacy of Ibogaine is above 70%. So it's exactly the opposite. We have a paper published that we did here in Brazil. We published it in the Journal of Psychopharmacology in England, that showed that for crack cocaine patients and cocaine patients, Ibogaine works for 72% of the patients. So it's totally it's marvelous the way that it works, because it really helps. But about what you asked, Lauren, here in Brazil we have the what they say the SUS. It's the Universal Health System. It's a system that the government pays for almost everything that you need in health. It works very good, very well to people that has serious diseases, and not so well for people that don't have serious disease. So if you, I always say this, if you faint in the street, you'll be very quickly driven to a hospital by an ambulance, and everything that you need will be provided, everything will be fine, you won't pay nothing. You will pay nothing. If you have a not so serious disease, it will take a little time for you to have scheduled a doctor and wait for this consultation, but you will have not only the consultation, but the medicines too. It will be provided for free. What we want to do here in Brazil is to register Ibogaine in our FDA, which is called Anvisa, and after this, after Anvisa recognizing that Ibogaine is a real medicine and it really works in a way that is acceptable for them, because if it was working only 1%, they will not accept. But more than 70%, they surely will accept it. After this, we hope to convince the government to buy Ibogaine and to provide it to addiction treatments for free. This is our goal. This is what we're trying to do here. And we are very confident that it will happen because the government is open to Ibogaine here. They want it because we have this here in Brazil, what people call the cracolands. The cracolands, every major city in Brazil has at least one cracoland. Is a place where thousands of people are using crack cocaine in an open sky scene, and the government doesn't know what to do with these guys. They want to treat them, but there's a lot of people. So what we are trying to do here is this, to approve Ibogaine to be used for free in these guys that are in the streets. But this is highly bureaucratic. Brazil is a highly bureaucratic place. So everything, you need to fill a lot of papers, you need a lot of signatures. So that's why we are taking some time. But the government is open to this, and we are confident that it will happen. But from what I'm seeing happening now in the United States with this project that Brian is the main responsible for this, I think that things are a little complicated too. It's not so simple to approve a medication like that. It costs a lot, millions and millions of dollars. But I'm confident that it will happen. Not in 1 year or 2 years, but I'm confident that it will happen too. And what we want to do here in Brazil is to help anyway. So I think that if we approve it in Brazil, I think that the FDA will see it with good eyes, and Anvisa and the FDA has some kind of relationship, so they can accept information from one to another. So I think that approving Ibogaine in Brazil to distribute to the people will even help the United States project about Ibogaine too.
Love that synergy. So I'm curious about values here. Um, both Brian and Bruno have named aspects of our respective healthcare systems that are broken. And so I'm curious about what are the values that we must preserve or develop in the process as we introduce these really powerful medicines to potentially broken healthcare systems. Um, Brian, do you want to kick us off?
You've asked a big question, the answer to which is going to hit a lot of different ears in different ways. And I would hope that the audience that is on your call will hear what I have to say with resonance. It's been my experience within Kentucky, I led the state's Social Security, Disability, and Child Support Enforcement systems. I led the Attorney General's Office of Medicaid Fraud and Abuse Control, and our entire job within that office was to be the state's chief law enforcement agency that investigated and prosecuted medical providers for fraud on the Medicaid system, as well as the abuse, neglect, and exploitation of Medicaid beneficiaries. And within each of these systems, I had the opportunity to observe that much of the U.S. healthcare system is engineered to perpetuate treatments of chronicity, treatments that address symptoms but rarely get to the core nature of the conditions that drive those symptoms. And in particular, when it comes to opioid dependency, we have therapeutic options that are necessary that have saved thousands of lives. But they are therapeutic options which do not get to the core of opioid dependency, and that is opioid dependency. Um, Suboxone and methadone are tools that we need to have now and forevermore because they work for many people. They don't work for a lot more people. So, looking for opportunities to diversify, expand, and improve upon treatment options that can deliver curative results, that can deliver restorative outcomes, as opposed to those that are administered every single day over the course of what could very well be the rest of someone's life, treatments that will keep them alive, but will not allow them to essentially optimize their existence. We've got to do better. And in terms of values, I think that we are able, through the process that began in Kentucky and has now completed in Texas, to engage in a little bit of an exposure exercise about what the core values are of actors within the substance use and mental health treatment fields. Are you here to restore a human being? Or are you here to manage this human being's symptoms in such a way as to monetize the sustainment of their misery? I think that Dr. Rasmussen and I are certainly here because we believe that there is an opportunity to bring restorative results, results that can cure the root causes of dependency issues, as well as other mental health conditions that are met with a cocktail of pharmacology that oftentimes people can never escape. It's my personal opinion that Ibogaine is a genuine emancipation medication that has the capacity to free captive individuals who cannot escape substance dependencies or the collateral consequences of synthetic pharmacology in the way that they are physiologically trapped by those to treat mental health conditions. We're going to see folks emerge as opponents, and in fact already have, who don't take that philosophy. They want to exploit economically as much misery as they possibly can for as long as they can, and they're going to fight back aggressively against anything that disrupts an economic model that, for instance, in Kentucky saw the issuance of 110 million individual doses of Suboxone over a 5-year period to a Medicaid population of 1.8 million people. That is treatment as a recurring revenue stream business model. This has a substantial capacity to disrupt all of that. So, the question is, which side are you on? Are you here for human restoration, or are you here for human exploitation? And I think that the team that can gather around the first is more than sufficient to beat the team that endorses the latter.
Yeah, and there's another problem that is the stigma about addiction. Because you see, for example, in the pandemics where everybody was at risk, very quickly the vaccines were ready. And there were millions and millions of dollars to develop the vaccines. But with addiction, the big pharma, they don't want to treat addiction. They don't pay attention. They think that people that are addicted are probably second grade human beings. So people say that it's common in meetings in the big pharma meetings that people talk about Ibogaine, and they sometimes say, no, we don't want our name, our brand involved in something like this, in treating addiction. So this is the problem. That's why some people around the world are trying to develop Ibogaine to other diseases like depression, like Parkinson's disease, because it would be easier to approve it if we say that it's for depression, for example. People that are struggling with substance disorder, use disorders, they are seen like people that are not trusty, that people that have problems of characters. And it's not that, it's a disease like any other disease. But it's a mental disease, but it's a disease. And sometimes it's not a disease, but sometimes is. Sometimes it's a disease and people need treatment. And sometimes it's not a disease and it's not to be treated. But this what decides is the patient himself or herself and the team that is taking care. But anyway, even people that have serious addiction, that are really struggling with this problem, they are seen not as normal human beings that deserve treatment. They are seen differently. So that's why Ibogaine is in the radar since 1962, and it's not approved yet anywhere in the world because it's for to treat addictions, and addictions they don't pay attention to it. And there are some addictions that are well seen. Nobody thinks it's strange if you arrive uh, in afternoon at your house and drink some whiskey or take some beer. This is okay. But to use other substances is not okay. It's a problem and you must be in rehab for 9 months. So this is the main problem. The people that are deciding this, they don't understand what is addiction. So they have a bias. And we must understand that this is a problem like a lot of other problems and simply fund research to understand what is this, to develop ibogaine and even other medicines that could be developed after ibogaine, because ibogaine could be the first medicine of a lot of other medicines that can be developed after we learn how ibogaine works. But there is no interest from the pharmaceutical industry about this because of the stigma. This is the big problem. So we must respect the people that have this problem and take care of them with humanity and being very open to hear them and really want to help and not to criticize.
Beautiful. So we have several questions, and I'm going to kick us off with one that seems really relevant. We just kind of talked about pharma companies. Now let's talk about insurance reimbursement. So one of our questions is, what's the best roadmap for full insurance reimbursement for ibogaine treatments in the USA and Brazil for people who qualify? More positive clinical trials, which could take years or more real world data, or both. So we'll kick it to Brian. How would you think about a path to full insurance reimbursement?
Well, in order to get full insurance reimbursement, you're going to, within the U.S. system, have to have a medication that is formally approved by the Food and Drug Administration as a medication that is suitable for use for the condition that's been developed in the United States. So FDA approval of Ibogaine as a treatment for substance use disorder is going to be the prerequisite for its coverage in health insurance. Now, if we work with the system that we have and we assume that there are no federal changes, it is my hope that we can see that process play out over approximately 6 years. There are breakthrough therapeutic results that are delivered by Ibogaine, certainly compared to what we have. And insofar as he could receive breakthrough designation status, that can help us beyond the time curve. If there are any substantial federal reforms, they will do nothing but help us accelerate. And I share the questioner's distress. The reality is, if the next 6 years are like the last 6 years, we're going to lose hundreds of thousands of people who could otherwise be saved while we're trying to drive this through. In many ways, a valid, but in other ways, a very laborious and bureaucratically heavy process that is not as responsive to reality as it should be.
Yes, and here in Brazil, what happens? The biggest difference between Brazil and United States relating to ibogaine is that in United States, ibogaine is scheduled. It's a Schedule 1 substance, so it's the most rigorous scheduling. It's like heroin, and in Brazil, it's not scheduled. It's like aspirin, so it makes it a lot easier to work with it. as I mentioned it before. But in any one of the countries, the main goal would be show to the government a very well done research showing good results, showing that ibogaine works better than any other approaches. If we can show this, and we that work with ibogaine, Brian know this, I know this, the results is not difficult to achieve because ibogaine really works. The difficulty is to do a research that they will accept, because normally they make a lot of new rules to the research that you are not used to. So when you show a research, they say, no, this is not good, I need more. But anyway, this is the goal. If you can show a research to the government and they accept it as a proof of ibogaine works, in Brazil, automatically it will be paid by the insurance and the government if patients need, almost automatically. This is our problem now. We're trying to do this research. In the United States, I think that we have another challenge. After proving it, we'll need to schedule it to maybe from Schedule 1 to Schedule 3, something like that. But you see, like in the medical cannabis movement, they are trying to reschedule cannabis, and it's difficult because people in the government, it's difficult to convince them of a thing that they believe since the decade of from the 60s. They don't believe that, they don't understand that science has evolved and we knew new informations about things. So it's that in the United States, it will be more difficult than in Brazil because of this question of the scheduling. We don't have ibogaine scheduled here, so it will be simpler. Although it's not easy, but it's not so complicated as in the United States.
Okay, so let's shift to this question, which I think Bruno and Brian, you might bring really complementary insights to, as we're thinking about approval and rescheduling. What ibogaine formulations are being considered in your respective spheres, and how do we ensure sustainability?
Well, just a comment about this. Although ibogaine is medicine extracted from a plant, it's the use that will be made in the United States for research. And what we use here, it's a standardized medicine. So it's not exactly a herbal supplement. It's extracted from a plant, but is a semi-synthetic medicine. So we extract substances from the plant, and in the lab we transform it in new substances. So this is not a problem because it's made under the highest standard. It's the what we call the GMP practice, the good manufacturing practice. So this is not a problem. What will be used in the United States for the research, and what we use here, and we will use here to the research, is this medicinal ibogaine, let's say, and not the any kind of herbal supplement that cannot be standardized. This is a real problem. You don't know if you use an herbal supplement, you don't know how much you are taking. No, with this research, we must need exactly that the patient is taking, for example, 10 milligrams per kilogram. And so the ibogaine that should be used should be with high purity, more than 99%, and produce it under GMP standards.
Within the U.S. drug development process, I have been educated on the fact that the FDA's process requires the creation of pharmacology that have unique chemical signatures. So this means, as Dr. Rasmussen has said, the notion that we would just use ibogaine as a singular alkaloid as it exists in nature is not a reality, at least as the FDA currently functions, that we'll be able to see come to pass. There is more likely to be a synthesized version of ibogaine paired with a molecule of some kind that the drug developer would be able to claim as its own unique contribution to its Okano. There are some developers who have in mind the pairing of a magnesium molecule with Ibogaine to meet that FDA requirement while also mitigating cardiac risk. You have one drug developer that is applying artificial intelligence to the Ibogaine molecule in order to deconstruct it. I've spoken with a scientist by the name of Dr. Dalibor Samish, who is in a lab at Columbia University and is applying AI to what he says is by far the most complex molecule that he has ever seen as a PhD genius organic chemist. Their objective is to create specialized alkaloids derived from ibogaine that are targeted to specific mental health and neurological conditions. And this is a project that he says that is going to have a generational time frame in terms of their creation and deployment. In the immediacy, they are working on an ibogaine alkaloid that will retain both the psychoactive and addiction interruption properties of what exists in nature, while removing that component that leads to cardiac risk. So if there could be the creation of an ibogaine molecule that brings all the good and eliminates just that one little aspect that creates that cardiac risk, that would be revolutionary. In terms of how it's done sustainably, I was just at Psychedelic Science 25 and met with a lot of folks who are stakeholders in Gabon who also have a very similar question. And the answer to that is there are ways to assure that there is a supply chain of ibogaine or ibogaine derivatives which meet the immense demand within the Western medical infrastructure, and in particular the United States. There are ways to do that through the replication of yeast that have been programmed to yield the alkaloid. There's a similar process that can be used within algae. There are ways to create a self-contained supply chain within the United States. Now, that is not in any way to try to discount or ignore the significance of the relationships with West Africa that need to exist as this project is executed across the country. As was said earlier, there's centuries of wisdom that needs to inform this process, and there needs to be reciprocal cultural and economic cooperation offered to the West by the West to the possessors of that knowledge. Under no circumstances, should the iboga plant be the object of harvest or the source of supply chain for Western medical infrastructure. That is not a sustainable way to guard that resource, and that resource has immense cultural significance to people who should not be disturbed because the West has substance use problems that can be addressed through alternative means that don't impact the natural environment.
I really appreciate that response. I want to shift a little bit from the drug and plant itself to Katie's question, and this is for Bruno. And she is wondering, you mentioned the importance of both physical and psychological preparation. So, what does psychological preparation look like for patients in Brazil? And what psychological support might be helpful in the days following?
Yes, this is a good question because the way we see Ibogaine treatment, we see that Ibogaine is a psychotherapy facilitator. This is the way we think about it, and this is the way we do it. So when a patient arrives wishing to do the treatment, we do a psychological evaluation to be sure that the patient has no important comorbidities like psychosis, schizophrenia, and things like that, which at this moment are contraindications for ibogaine treatment. Maybe in the future, with more research, it will not be true. But at this moment, we don't do treatments in psychotic patients. But when the patient has the profile to do the treatment, we do around 4 psychotherapy preparation sessions before the treatment and around 4 after. This is just to start because some patients need a lot more before, some patients need a lot more after. But as I said, we see ibogaine as a psychotherapy facilitator. So if some way. The patient refuses psychotherapy, we refuse the treatment. We respect the patient that don't want to do psychotherapy, but we ask for respect for our protocol that we believe in Ibogaine only with psychotherapy. We have this experience. I work with this for more than 30 years, and I always see that patients that don't undergo psychotherapy, the abstinence after Ibogaine, it's only a few months and not a lot of time or even forever, like we see the patients that are well prepared and well followed up after Ibogaine. So this is a good question because this is the main, this is the thing that really will help. What will help the patient is the psychotherapy. Ibogaine is just a facilitator, and this really works. Like MDMA and PTSD is the same thing. You give MDMA, but what we do during the session, it's psychotherapy. So psychotherapy is the answer, facilitated by the medicines.
Awesome. Brian, I'm curious in your context, is this what we're also trying to pursue in the United States?
And when you say that, what is that?
That, I mean, ensuring that this is paired with psychotherapy and preparation before as well as after.
Most definitely. Ibogaine is singular in terms of its capacity to deliver restoration of mind, body, and soul. But it is just the beginning. There has to be a treatment system that is developed which places long-term supports around an individual who is about the business of rebuilding themselves and rebuilding their life. That takes time. That takes effort. That takes the loving hands and support of the individual's friends, family, neighbors, and qualified mental health professionals who are aware of and trained in Ibogaine's unique properties so that they can assure that there is long-term sustained benefit given from that entryway opportunity of receiving Ibogaine.
Beautiful. Amazing. All right. So we have 1 minute left. I'm sorry we can't get to all of these amazing questions, but very quickly, I'm wondering, Brian, Bruno, you've been so inspiring, and there's a lot of questions around how can I get involved or how can I pursue a potential experience? And really quickly, what would your advice be to these individuals who are really interested in joining this movement?
Dr. Rasmussen,
Okay.
you want to go first?
Yes. Okay. Well, there's a lot. It's beautiful now because when I started 30 years ago, nobody even knew what was Ibogaine. So now a lot of people understand Ibogaine, and there's a lot of opportunities to help, to work with Ibogaine. For people that live in the United States, there are not so many opportunities because Brazil is far, but I think that the Brian's project, there's a lot of space for people that want to help because this is a big work. It will take a lot of work to do this. So I think that every help will welcome. And I put my email in the chat if someone wants to keep in contact, to ask more questions. I'm totally open to this, to answer. But is this? I think that there's a lot of opportunities to help if you can find in your neighborhood places that are working with psychedelics. Ibogaine is in the same field of other psychedelics. In the United States, you have this problem with the veterans, and they always need help. They are very, they need to be treated because it's really a big trauma to go to a war and come back. So I think that looking for veterans associations and things like that, you will find a place to help with this Ibogaine cause.
Amazing.
Thank you for this question, Lauren, and I want to answer it this way for the folks who are listening. The past 30 years of experience within U.S. society has seen a lot of wonderful progress in terms of how we truly live within the most beautifully dynamic multicultural society that has ever existed in human history. And we've done that as a people. Unfortunately, who we are as a people is we are not being well served by systems of power that have entrenched themselves upon the suffering of other human beings. I personally believe that the mission around Ibogaine presents not just an opportunity for the advancement of significant therapeutic breakthroughs within the U.S. healthcare system, but it also presents us with a fabulous unity opportunity to be genuinely counterculture in response to the fractions and divisions that are driven by centers of power, amplified by mass media, that that recognize that the dividend of division is control. This is an emancipation mission, and Governor Perry and I intend, as best we can, to build a broad based unity coalition that is rooted in everyday America in all of its beautiful multiculturalism to help be the voice of what must become a movement to shift those centers of power in such a way as to align with this mission. And to that end, AmericansForIbogaine.org is the website for the 501c3 public policy development and advocacy organization that aims to be the voice that will see that Ibogaine becomes the Manhattan Project of our time. Political wars are won in one of two ways, either through the assertion of power through money or through the assertion of power through the masses. This has the capacity to become a mass movement. So I would encourage your folks to be the seeds of that movement. Go to that website, follow Governor Perry, follow myself, get on social media, and just start spreading the word for what it is that we are trying to do and bring as many people into the tent as possible. Because as we move into January of 26, I believe that we will have 3 to 6 states that introduce legislation to join Texas as a partner, followed by another 3 to 6 states heading into 2027. We have a genuine opportunity to build a national mass movement that is unified around the advancement of this in such a way as to fundamentally shift how we do things, not just as government, but as a society. So I would just ask everybody to put your hands on it and help us strive.
Yeah.
I have no words. I am so inspired and grateful to both you, Brian, and Dr. Rasmussen for your leadership. And thank you for taking the time to share your gifts today and in all the days to come. I'm so grateful. I'm stammering, but just wanted to share. I grew up in a community that is most impacted by diseases of despair, and I haven't felt hope in a long time, and I feel that. And so hope goes a long way. So thank you so much for all that you do. And I think we're going to have to wrap it up. Um, but thank you all. And thank you, Bruno and Ryan, for putting that information into the chat as well.
Thank you. Thank you very much. Thank you for everything. And thank you, Brian, for this, because this is helping a cause that everybody is working for a long time. It's very important that you lead this. It will be great.
Yeah.
Doing this has been the privilege of my life, and I just hope that I can be the very best and most effective servant along with everybody else who is putting such effort forward to make progress. And Lauren, thank you for inviting Dr. Rasmussen and I to be here with y'all this morning. It's been an honor.
Yeah, for me too.
Thank you. All right. Bye, y'all.
Bye bye.